All right, are we ready? Gypsy looks ready. Sally looks ready. Apparently she has to come in every time now. So welcome back, everyone. So today we're going to talk about some of the new little things going on with Mr. Man. But real quick, I just wanted to say thank you to Michael. I did get the gift in the mail. Thank you so, so much. I was totally stupid girly over getting it. It's a little cow dog, so it's going to look great on our tree this year. So thank you so much. So before Sully had his issues with the squeaker, we started noticing, so he was about maybe like a year and 2 months, I guess, or just a year and a month or so, before he started having all those issues going on. And one thing we started noticing around that time was, I guess maturity started kicking in. He would listen almost on everything, like any command I would give, like he would just listen automatically. You know, days where we assumed he would do something wrong, he would make the right choices. So it was like all those proud like parent moments of, yes, we did good with training, he's doing good, you know, all that fun stuff. Even my husband would constantly be saying, honey, he didn't bite me today. You know, things like that. And Sully still does bite him, like play bite. Like they have this like very boyish roughhouse kind of relationship, which is fine. Seriously, cat, not my scarves. It's like having another freaking puppy while I'm trying to do this video. You know, he even started greeting my husband better, not running up and automatically biting his feet. You know, we started seeing like this really awesome change start happening from, you know, bad puppy behavior to adulthood in him. And, you know, but that kind of all went out the window after surgery. Maybe not all out of the window after surgery, but definitely surgery has done a little bit of a setback on things when it comes to Sully. There's definitely been some new developments since he's recovered from surgery. For instance, he likes to run up to Silver and just chomp down on her face. He started doing it almost like as a herding type thing, like where he would just nip at her face. And now it's turned into a full-on, I'm gonna run up and chomp on her face. And I get extremely upset and pissed off when he does that because she's my oldest baby. I mean, I'm very protective of Silver. I know he knows I'm upset about it. I can see the look on his face, like he knows he's doing wrong, but he's continuing to do it. And no matter how many times I tell him to leave her alone or no bite or anything else, like he's not listening. So we're back to that where he's, I'll listen if I want to kind of attitude. We're having to also watch out more for piffs happening lately. Like they're happening almost daily with him and the girls. He's constantly hoarding toys. He's over possessive of food, crazy over possessive of me. That's where most of the piffs happen, is them trying to get attention from me or them trying to sit next to me. So there's a lot of correcting on that stuff. And I'm pretty sure most of this has to do with just everything he's gone through for the last 2 months, because, you know, for 2 months he's been ill, and, you know, then he had the surgery and had to recover from the surgery and had to be confined. So all that confinement and lack of play and lack of food because he couldn't hold anything down half the time, like, so there's all these factors that have really like kind of, I think, messed him up a little bit. But he's still playing really well with his sisters, and, you know, he's remembering, I guess, you know, proper behavior and manners. So, I mean, we're getting back to where we were before with our little, like, harmonious little, you know, zoo that we got going on here. But he's definitely upset and a bit traumatized from the whole experience. And the biggest challenge I feel like he's kind of going through right now is his anxiety, his separation anxiety, to be specific, when it comes to mommy. When I go to work or leave the house, my husband is stuck with this.
What do you want, Sully? I don't know what you want. What do you need? This is the 3rd time we've been out. What do you need? Mommy's not here. I told you she's working. You want me to hold you? You want to come up in my lap? Do you want to go outside? You're looking for mommy? What's wrong, baby?
This poor boy is so traumatized with not being with me anymore. It's like, and he's always with somebody at home, and usually with separation anxiety and dogs, you know, you leave like a t-shirt that smells like you, or you keep them in their kennel, you know, to have them have a safe little calm place and give them something to do to help with that anxiety. You do little practice sessions where you leave the house like for 5 minutes and come back, and then 10 minutes, like increase the time. What did you just do, cat? She's practicing her gymnastics. No, no, those are LPs. Get off the LPs. But with him, he's always got somebody here. He's always got things to do, like, and he's just so focused on where I have gone to. Like, he is so traumatized, the poor guy. And I'm not really sure how to fix that. Like, even my husband, like, tried to curl up with my side of the bed, like, you know, so he could smell me on the pillows and stuff like that. And he said it worked for like a little bit, but then he went back into like crying freak out mode. And I definitely feel like that's also where the possessiveness comes in, when he has like his piffs with the girls over me. He is like so freaked out not to, like, that it's going to happen again, I think. So I think with time things will get better. It's just, it's heartbreaking and frustrating, and yeah, things like that. I can't say he's back to eating slower-ish again. I can understand why he's, you know, back to eating as fast as he was, you know, because he's just excited he can eat the food and keep it down. You know, regarding his pulling on his walks, like, that's actually decreased already. Again, he's starting to remember his manners better on walks. I mean, I expected it to happen anyway, the pulling and the lack of listening. I mean, to be confined for 2 weeks, you know, recovery for a cattle dog, I expected a bunch of bad behavior. But some of this stuff I wasn't expecting, like how bad he's chomping at Silver, and just how much anxiety he has. But I know a lot of you are raising your puppies along with Sully, and I guess my best advice at this stage is just be patient, because there is a change that will happen, and it could revert back with or without, you know, a surgery. But the maturity is a huge part, I think, when it comes to cattle dogs becoming more calm. And I really feel like there's a range there between a year and a half where that happens, where you start to see the adults in them start coming out. I know a lot of people say it's bad training if your cattle dog still has issues up to 2 years, which I don't understand that, because me and almost every other cattle dog parent out there will tell you the first 2 years is the toughest. And I think that's because they will always try to test you and throw stuff at you. I mean, not everybody's going to be in my situation where we had a surgery and all that stuff to go through to bring up these new things, but we are experiencing new things with him. And for those of you who are still with me, I want to know how his healing is going. His scar is still a little bit pink. There's some weird bumps happening, which I'm not sure what that's about, but he does need to go get his rabies vaccine soon, so I'm going to ask them about that then. But there's nothing weird happening, like ooze-wise or anything, but he's still healing really well. He's running and being an idiot like he should be, and just, yeah, he's so full of life again and everything else. So those are all good signs. We just got to work on a little bit more behavior, and I'm going to give him a few more days to heal, and maybe try to set up a day to take him on a hike just to see how he does on it. I think he will do fine, because we're already increased our walks and he's doing great on the walks. There's no more tiredness, you know, after 20 minutes like there was, the poor guy. So, you know, we're getting there. Things are getting there. But I can definitely tell the scar is still in a healing process. It's got this, like, I don't know, there's a look to it, if that makes sense. And I definitely want to take him to a couple more places, because I also feel like he's got a fear now of, oh my God, we're going to the car, that means we're going to the vet. You know, so I want to take him to a few places and see how he does with things, because we definitely need to practice on reactivity still, because he failed miserably on that the other day on his walk. Even though he listened to everything else that I was telling him and did not pull, he saw a husky and just went absolutely nuts. But that is just what's kind of going on right now with the boy, and yeah, we just have to stay on it and be consistent, which is what I say all the time on this channel. So if you're going through, you know, weird little episodes, you know, puppy hiccups with your cattle dog, to me, it's normal. But I have no doubt he will get to where he needs to be, especially once, you know, the older they get, you know, the more they start thinking more clearly without that crazy puppiness and going through them. But that is it for today's video. Remember to click all the buttons, and we will see you in the next one. Take care, guys. Bye. Gypsy woo. All right, that's enough. Enough. Drop it. Everybody drop it. Thank you. That's enough. We're done. If you're going to act that way, we're not playing no more. I mean it, woo-woo. Same with you, sir. Trying to sneak up behind me. No. That was too much. We're done for the night. He's like, we're never done, Mama. I said, give me that Frisbee. I want to eat it. Look at that smile. Look at your smile.